Now we continue with the 5 transporting points, the actions from the classics, part 2. According to the spiritual axis from chapter 44, the yin organs corresponds to the 2 winter usual points. The color corresponds to spring, use spring points. Seasons corresponds to summer, use the stream points. Sound corresponds to late summer, use the river points. Flavor corresponds to autumn, use the sea points. When the yin organs are affected, use the well points. When the disease affects a change in the complexion color, use the spring points. When the disease manifests intermittently, use the stream points. When the disease affects the voice and there is stagnation of qi and blood in the channel, use the river points. When the stomach is affected and there are digestive disorders, use the C points. Now we have here the 5 transporting points according to the classic of difficulties. The summary. First, the well points is for the fullness under the heart, for irritability, mental restlessness, insomnia. The spring points for hot sensations of the body to clear heat. The stream points, feeling of heaviness and joint pain, that is for painful obstruction syndrome from dampness. Number 4, for river points, that is for breathlessness, cough, hot and cold sensations, asthma. Number 5, the C points, for rebellious qi and diarrhea, for digestive disorders. These rules are fairly straightforward and have some points in common with those from chapter 68 of the Classic of Difficulties. The spiritual axis recommends the use of the well points in yin organ diseases. This is similar to the Classic of Difficulties recommendation of these points in mental restlessness and irritability, particularly if deriving from the heart pattern. The spiritual axis use of the river points for problems of the voice coincides with the classic of difficulties used for problems of the throat. The use of the C points is also practically the same in the two classics. However, the spiritual axis recommendations are much less followed in clinical practice than those from the classic of difficulties, as they are of lesser practical significance. The particular use of the 5 transporting points recommended in chapter 44 of the spiritual axis does not have an important clinical relevance. For example, the use of the well points for problems of the yin organ is not generally followed, and in fact, it contradicts chapter 6 of the same book, which recommends the use of spring and stream points for problems of the yin organ. The suggested use of the spring points when there is a change in the complexion color and the stream points when the disease is intermittent are also not of great clinical relevance. The use of the river points when the voice is affected is confirmed by their indications. LI 5, raving, laughter. Stomach 41, raving. PC5, loss of voice, halting speech. Spleen 5, impaired speech, laughter, sighing. Heart 4, loss of voice. Kidney 7, curled tongue with inability to speak. Tribal burner 6, sudden loss of voice. Liver 4, for sighing. The use of the C points for digestive disorder is common, and there are many examples of such points. Lung 5, for vomiting, diarrhea, abdominal distension. LI 11 for abdominal distension and pain. Stomach 36, all digestive disorders. Spleen 9 for diarrhea. Heart 3 for vomiting with foamy saliva. Bladder 40, vomiting and diarrhea. Kidney 7, diarrhea, abdominal distension, borborygmy. PC3 for diarrhea, vomiting due to summer heat. Triple burner 10, vomiting with pus and blood. gallbladder 34 for vomiting, liver 8 for diarrhea. On chapter 44 of the spiritual axis, we have a summary. First, the well points is for yin organs. Number 2, spring points when there is a change in complexion color. Number 3, we use stream points for intermittent symptoms. And number 4, we use river points when the voice is affected. And number 5, we use C points for stomach diseases. Thank you for your attention.
We continue discussing relationship to Sanjiao of the source points. Because of the nature of circulation in these areas, the source points may be likened to a great market. In these concentrations of heightened activity, there is a brisk trade in information from the body as a whole. In the distal appendages of the arms and legs, far from the internal organs, nutritive circulation reaches its apogee, just like the branches at the top of a tree or trading posts at the far corners of an empire. Like bazaars where many cultures meet, the source points bustle with activity. The abundant supply of qi and blood here requires not only adequate capillary supply, but just as importantly, the ability to reabsorb fluids back into the circulatory system in an area with lower blood pressure. In other words, just as blood comes far from the heart to the ankles and wrists to facilitate movement, it must also be quickly carried away and replaced to prevent swelling that might compromise the range of motion. Again, when circulation is compromised, it is at the wrists and particularly the ankles where the fluids build up. Thus, the arms and legs experience a rapid turnover of blood from other parts of the body. One might also say that the areas around the source points receive constant communication from a wide variety of distant organs. Therefore, despite or because of their distance from the internal organs, the source points have a unique clinical value that is associated with the diversity of information that they receive from elsewhere in the body. The concept of the triple burner, which is a hollow yang organ, was linked to the spaces between the muscles and surrounding the connective tissues. While these spaces exist in all muscles and in the lining around the organs of the abdomen, the substances within those linings will vary in different areas of the body. In fact, it is most varied in areas furthest from the trunk. This seems counterintuitive at first. How can areas so far from the primary metabolism of the internal organs be filled with a diversity of qi and blood? One would expect that the areas around the organs themselves might have more of the various types of qi in the body. But in fact, while the organs of the trunk may have more qi and or blood, the nature of that qi and blood is quite specific to that organ. For example, while the lung is filled with qi, it is a particular type of qi classically termed lung qi, which is a component of ancestral qi. Similarly, the liver is filled with blood, but of a type called liver blood in Chinese medicine. By contrast, at the source points, there is a fairly even mix of qi and blood from every corner of the body. Combine this with the high nutritional requirements of the joint spaces, and one can begin to appreciate how movement and diversity of all qi in the body combines at the source points around the ankles and wrists. So here you could see a very good illustration of the distribution of circulation at the wrist. So at the source point, like the lung 9, the increasing flow of channel qi at the highly active joint on the wrist creates the lively interplay, which brings source qi from the fluids of the triple burner into the qi dynamic of the channel. So from lung 11, this is where the channel qi comes out. It moves to lung 10. This is where the channel qi begins to flow. And at lung 9, the channel Qi will now begin to pour with force, thus drawing ample source Qi. It is important to note how the mixing of the various types of Qi is vital to normal physiology. Ultimately, this involves an aspect of the role of the channels as a communication system, one of the three general functions of the channels described. Communication occurs through the medium of fluids. Consider the following example from the clinic. If there is a heart Qi deficiency, this information enters the spaces of the triple burner in the chest as a change in the environment of the other organs. This environmental shift travels through the fluids of the body to points of highly active transfer at the source points. There, information regarding the heart might enter other channels very quickly. As has been shown in clinical experience, stimulating a point like heart 7, the heart source point, has a noticeable effect, which in Chinese medicine corresponds to a benefit to heart Qi. Stimulating the heart source point sends a precise signal to the channel system as a whole, which initiates a chain reaction that benefits heart Qi. Thank you very much for your attention.
Okay. Continuing our discussion on the connecting or the low points, we now talk about the use of low points on their own. The use of the connecting points on their own according to chapter 10 of the spiritual axis. The use of the connecting points by themselves is based on the full or empty symptomatology of each connecting channel. The full and empty symptoms of the connecting channels are described in chapter 10 of the spiritual axis. They are listed in the following table. So here we have the blue connecting points of the different channels and their indications in full and empty conditions. So let's start with lung 7. Right, it's indicated for hot palms and wrists in full condition, and for yawning, frequent urination, incontinence of urine in empty condition. For the large intestine, we have Li6. It's indicated for toothache and deafness in full condition, and for sensation of cold in teeth, fullness and congestion in the chest for empty condition. For the stomach, we have stomach 40. It's indicated for insanity in full condition, for rebellious Qi in the throat, if there's throat obstruction and loss of voice, and for empty condition where there is flaccid or atrophied muscle of legs. For the spleen, we have spleen 4. It's indicated for abdominal pain in full condition, for rebellious Qi where there is food poisoning, and for empty condition, we have, it's also indicated for abdominal distension. For the heart, we have heart 5. It's indicated for fullness and oppression of the chest in full condition, and aphasia for empty condition. For the small intestine, we have SI7. It's indicated for loose joints, atrophy of arms and stiff arm muscles and stiff elbow for full condition. And for empty condition, it's indicated for long finger-shaped warts and itching scabs. For the bladder, we have bladder 58, which is indicated for nasal congestion, headache, and backache in full conditions. And for clear nasal discharge and nosebleed in empty condition. For the kidneys, we have kidney 4, which is indicated for retention of urine in full condition, and for rebellious irritability, depression, oppression of the chest. And for empty condition, it's indicated for lower backache. For the pericardium, we have pericardium 6, which is indicated for chest pain in full condition. and stiffness of the head and neck for empty condition. The triple burner, we have triple burner 5, which is indicated for spasm of the elbow in full condition and for flaccid arms and muscles in empty condition. For gallbladder, we have gallbladder 37, which is indicated for fainting in full condition, and for weak and flaccid foot muscles, and difficult to stand from sitting position in empty condition. For the liver, we have liver 5, which is indicated for swelling of testicle hernia-like disorders in full condition and also in abnormal erection. And in empty condition, it's indicated for itching of pubic region. For the Renmai channel, we have REN15, which is indicated for pain in the skin of abdomen in full condition and for itching of the skin of the abdomen in empty condition. For DUMAI, we have DU1, which is indicated for stiffness of spine in full condition and for heaviness of the head and tremor of the head in empty condition. For the great lobe of the spleen 21, it's indicated for ache and pain all over the body. And it's also indicated for weak limbed muscles for empty condition. The great lobe of the stomach is indicated for rapid breathing, irregular breathing, and sensation of knot in chest in full condition. The indications of the connecting points according to the full and empty symptoms from Chapter 10 of the Spiritual Access do not have the same clinical relevance for all points. For example, the indications for LI6, which is sensation of cold in teeth, fullness, and congestion in the chest, are not of great clinical significance. The indications with greater clinical significance are as follows. Stomach 40 for insanity, spleen 4 for abdominal pain in full condition and abdominal distension in empty condition, heart 5 for aphasia in empty condition, kidney 4 for backache in empty condition, pericardium 6 for chest pain in full condition, and liver 5 for genitalia problems in full condition and itching genitals in empty condition. So to summarize, the use of the connecting points on their own, according to Chapter 10 of the Spiritual Access, states that the connecting points can be used on their own, and that the connecting points are chosen according to full or empty state of the connecting channel. Thank you for your attention.
Now we go to the back transporting points, the bladder 13, the back-Shu point of the lung. To locate, it is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the third thoracic vertebra or the T3, as illustrated in the picture. To find, first locate the spinous process of C7. From there, count down 3 spinous processes to the lower border of the spinous process of the T3. Measure 1.5 tune lateral to locate bladder 13 on the highest point of the paraspinal musculature, or with the patient seated and their arms hanging down. The spinous process of T3 is generally on the level of the medial end of the scapular line, which is to locate the bladder 13, 1.5 tune lateral to the midline. Located on the same level are DU12 on the midline, a point of extra point EXB2, 0.5 tune lateral to the midline, and bladder 42, 3 tune lateral to the midline. Sa needling, 0.5 to 1 tune obliquely towards the spine, In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needling retention. The needles can be secured with tape. Caution, pneumothorax. For chronic lung Qi deficiency without heat signs, we use moxibustion. For the actions and indication, bladder 13 tonifies, spreads, and descends the lung Qi, nourishes the lung yin. It also clears heat from the lung, releases the exterior, and opens the channel, alleviates pain. For the special features, the back-Shu point of the lung, major point for all disorders of the lung deficiency, and excess patterns. Bladder 13 point can be used in both exterior and interior patterns of the lungs. In exterior patterns, it releases the exterior by stimulating the diffusing and descending of lung Qi, and thus help to expel wind cold or wind heat. In particular, it is indicated if the exterior attack is accompanied by cough. In invasions of exterior wind cold with the prevalence of wind manifested with sweating, it can regulate nutritive and defensive Qi in the same way as bladder 12 XIMEN. In interior patterns, it restores the descending of the lung Qi and is therefore used for cough, wheezing, and breathlessness. Bladder 13 also clears interior heat from the lungs and is therefore used in acute condition of the lung characterized by heat at the Qi level of the 4-level pattern identification, as may happen in acute bronchitis following an invasion of wind. The symptoms at this stage are high fever, thirst, a cough with sticky yellow sputum, breathlessness, restlessness, a rapid pulse, and a red tongue body with a thick yellow dry coating. Needled with reinforcing method or direct moxa, it tonifies lung Qi and is effective for chronic deficiency of lung Qi, especially if combined with Du12 Sheng-Shu. When needled in this way, it also consolidates the space between the skin and muscles, and when this is too relaxed, making the person prone to invasion of external wind. Bladder 13 also nourishes lung yin, and for this purpose, it frequently combined with bladder 43 Gao-Hua-Shu. The indication desired to commit suicide must be seen in the context of the corporeal soul, Pu, which is housed in the lungs. The corporeal soul is a physical soul with centripetal movement, constantly materializing and constantly separating into different constituent aspects. The corporeal soul is in a relationship with Gui, that is ghost or spirit of dead people. Confucius said, Qi is the fullness of the mind, which is the Shen. The corporeal soul, which is the Pu, is the fullness of Gui. He Xiang Gong said, the turbid and the humid 5 flavors from bones, flesh, blood, vessels, and 6 passions, this Gui is called corporeal soul, which is the Pu. This is yin in character and enters and exits through the mouth and communicates with earth. The centripetal forces of Gui within the corporeal soul, constantly fragmenting, are eventually the germ of death. With regard to fragmenting, there is a resonance between the Gui and Huai, Gui with earth in front, which means pieces. Because of the connection between the corporeal soul and death, points associated with the corporeal soul, such as bladder 13, are indicated for suicidal thoughts, as we shall see below. The point bladder 42, which is on the outer bladder line, level with bladder 13, is also indicated for suicidal thoughts. So for the summary of functions, bladder 13, it stimulates the diffusing and descending of lung qi. That is for cough, wheezing, breathlessness, fullness of the chest, persistent cough in children, chest pain from the lung patterns, expectoration of phlegm. It also expels external wind, that is for aversion to cold, fever, cough, sneezing. It also regulates nutritive and defensive qi. Bladder 13 tonifies lung qi and nourishes lung yin, lung qi deficiency, consumption, steaming bones, night sweating, fever from yin deficiency, dry mouth, and throat. It also clears heat, lung abscess, rapid pulse, and fever. It also calms the mind, manic behavior, desires to commit suicide. Thank you for your attention.
Let's discuss liver 14, front collecting point. This is also called the cycle gate, XIMEN. Location in the 6th intercostal space on the mammillary line or fourth zone lateral to the midline. How to find liver 14? So we have a quick method, especially in men. The nipple is generally located on the level of the 4th intercostal space. From there, palpate downward 2 intercostal spaces and locate liver 14 in the 6th intercostal space. Or, for more precise orientation on the rib cage, palpate for the manubriosternal synchondrosis, a well-defined horizontal bony structure on the sternum. Lateral to it, locate the 2nd rib and below it, the 2nd intercostal space. From there, count downward 4 intercostal spaces to the 6th intercostal space, and there locate liver 14 on the mammillary line, fourth zone lateral to the midline. GB24 is located in the 7th intercostal space, located on the same level, tooth zone inferior to the sternocostal angle, are REN 14 on the midline, kidney 21, 0.5 zone lateral to the midline, and stomach 19, tooth zone lateral to the midline. Needling 0.5 to 1 zone obliquely, either in a lateral or medial along the course of the ICS direction. The latter is recommended for disorders of the breasts. Caution, pneumothorax. Actions, indications. Liver 14 regulates liver qi and liver blood, especially in the upper and middle burner, cools the blood, disperses accumulations, harmonizes the liver and the stomach. Special features, front mu point of the liver, meeting point with the yin wei mai and the spleen channel, exit point. Liver 14 has a similar function to that of liver 13. The main difference being that liver 14 affects mostly the stomach, whilst liver 13 affects more the spleen. Please note that there is an alternative location for liver 14 at the lower edge of the rib cage, in line with the nipple, or in women, fourth zone from the midline. In fact, one could look upon this as 2 separate points. The one in the intercostal space is used more for channel problems, while the one at the lower edge of the rib cage is used more for organ problems. So here is a figure demonstrating the alternative locations of liver 14. This point is frequently used whenever liver qi stagnates and invades the stomach, causing belching, nausea, vomiting, and hypochondrial distension and pain. It harmonizes liver and stomach qi. The pulse is typically wiry on both middle positions. To summarize the function, it promotes the smooth flow of liver qi and harmonizes liver and stomach. So there will be hypochondrial distension, sighing, breast distension, epigastric distension and pain, hiccup, belching, vomiting, and hardness of the epigastrium. Liver 14 is the last point on the liver channel, and indeed the last point in the great circulation of Qi, which begins at lung 1 and passes through all the 12 channels, ending one complete cycle at this point. This is reflected in its name, cycle gate. Liver 14 is the front mu point of the liver. The term mu means to gather or to collect, and the front mu points are where the qi of the Zhang Fu gathers and concentrates on the anterior surface of the body. It is in the region of this point that the liver channel spreads through the lateral costal region, diaphragm, and chest. Its main sphere of action, therefore, is on regulating the free flow of qi in these areas. And in contrast to liver 13, which focuses on the middle and lower jiao, liver 14 acts primarily on the middle and upper jiao. The spiritual pivot states, with anger, the qi rebels upwards and accumulates in the chest. If liver qi is obstructed in the chest or lateral costal region, there will be pain, distension, or fullness. Whilst if liver qi invades the lung and obstructs its descending function, it will give rise to cough, sighing, and dyspnea. The liver sinew channel links with the breast, and the entire breast region is strongly influenced by the liver. If liver qi is obstructed in the breast region, therefore there will be pain, distension, and even masses, all of which may fluctuate with the menstrual cycle, being most pronounced in the days immediately prior to menstruation. Liver 14 is an important adjacent point in the treatment of this common condition. The intimate relationship between qi and blood is clearly expressed in the saying, qi is the commander of blood. When qi moves, blood moves. Severe or prolonged qi stagnation, therefore, will lead to blood stasis, manifesting as hardness or masses with cutting pain in the chest, lateral costal region, abdomen, or hypogastrium. Liver 14, by virtue of its ability to circulate both qi and blood, is indicated in all these situations. Liver 14 is also specifically indicated for cutting or stabbing pain of the heart, reflecting its status as a meeting point of the liver channel with the yin linking vessel. According to the classic of difficulties, when the yin linking vessel is diseased, heart pain will result. According to Zhang Qing Yue, if anger occurs during or after eating, it injures the stomach and spleen. This vital observation emphasizes the great importance ascribed to a peaceful and harmonious state of mind during mealtimes. If instead there is disturbance, conflict, frustration, resentment, or outright anger, they may wreak turmoil in the digestive system. If liver qi transversely invades the stomach in this way and impairs its descending function, the stomach qi will stagnate or rebel upwards, leading to epigastric distension and pain, acid regurgitation, vomiting, and hiccup. Liver 14 is an essential local point in the treatment of this pattern of liver-stomach disharmony. If liver qi transversely invades the spleen and impairs the spleen transportation and transformation function, there will be abdominal distension and diarrhea. Although liver 14 is less used clinically in this situation than liver 13. A specific indication for liver 14 is injury by cold leading to heat, which enters the blood chamber. This refers to attack and penetration of cold during menstruation or after childbirth. The cold transforms to heat and gives rise to alternating fever and chills, hardness and fullness in the lower abdomen, chest, and lateral costal region, and clear consciousness during the day with disordered speech at night. This pattern was first described in the Treatise on Injury by Cold by Zhang Zhongqing, who recommended the administration of minor bupleurum decoction and needling liver 14, especially in the case of manic raving. The Tang Dynasty author, Xu Xuexu, a scholar of the works of Zhang Chongqing, in his discussion of the treatise on injury by cold, said concerning heat entering the blood chamber in women when Shao Chai Hu Tong is too slow, needle liver 14. Liver 14 is also indicated for uterine bleeding. Finally, like liver 13, liver 14 is an important point in the treatment of running piglet Qi. Thank you for your attention.
Continuing our discussion on accumulation or Xi points. Today we discuss spleen 8, the earth pivot. Spleen 8 is located 3 chun distal to the junction of the shaft and the medial condyle of the tibia, near spleen 9, and at the posterior border of the medial crest of the tibia. So how to find spleen 8? First, we measure one hand breadth directly inferior to the medial condyle of the tibia. So this is where spleen 9 is. So spleen 8 is located 3 chun distal to spleen 9 on the posterior border of the medial crest of the tibia, on a line connecting spleen 9 and the highest prominence of the medial malleolus. Here we have an illustration on where the spleen 8 and spleen 9 are located. So needling spleen 8 is done vertically 1 to 1.5 chun in depth. For its actions and indications, spleen 8 regulates the uterus and the blood, and it also regulates the spleen and eliminates dampness. As its special features, it's a Xi-cleft point, and it's an important point for acute dysmenorrhea, often used in combination with LI4. Okay. Like all accumulation points, as spleen 8 removes obstruction and stops pain, particularly in acute excess patterns. It is very much used in acute cases of dysmenorrhea to stop pain. It is also used as part of a treatment strategy for chronic dysmenorrhea, when this point would be used just before the period to move Qi and invigorate blood, usually with reducing method. And other points would be used usually with reinforcing method to treat the root of the condition. Spleen 8 regulates the uterus and stops pain by invigorating blood. That is, removing stasis of blood. Like all accumulation points, this point can also stop acute bleeding, and it is used to stop excessive menstrual bleeding and bleeding from the bowel. So for summary of its functions, spleen 8 as an accumulation point treats acute pain. It is frequently used to stop menstrual pain, and it stops excessive menstrual bleeding. Spleen 8 is the Xi-cleft point of the spleen channel. The Xi-cleft points are where the Qi and blood, which flows relatively superficially along the channels from the genital points, gather and plunge more deeply. The Xi-cleft points in general are indicated in the treatment of acute conditions and pain, while the Xi-cleft point of the yin channel have an additional action of treating disorders of blood. The spleen controls blood, and its channel enters the lower abdomen, joining with the consumption vessel at REN 3 and REN 4. Spleen 8 has a specific and important action on resolving blood stasis in the uterus and lower abdomen, being indicated in the treatment of dysmenorrhea. irregular menstruation, and abdominal masses in women due to either blood stasis or Qi stagnation. A specific indication for this point, mentioned in the illustrated classic of acupuncture points on the bronze man, is a hot flowing sensation spreading down the inner thigh to the knee when pressure is applied to the abdominal masses in women. As the Xi-cleft point, spin 8 is specially suited to treating acute conditions, and it is often combined with LI4 in the treatment of acute dysmenorrhea, both points being strongly reduced, often with the addition of electroacupuncture. Spleen 8 has a secondary action of harmonizing the spleen and resolving damp, being indicated in the treatment of abdominal distension, poor appetite, difficult urination, edema, and leukorrhea, especially when these symptoms accompany disorders of menstruation. The affinity of spleen 8 for disorders of the lower abdomen is emphasized in various classics. The investigation into points along the channels by Yan Zhenxi of the Ming Dynasty goes as far as to say there is no disorder of the lower region that cannot be treated with spleen 8. Well, according to the Ode to Elucidate Mysteries, spleen 8 dominates the lower region, while spleen 21 dominates the upper region and stomach 25 the middle region. In the correspondence system of early Chinese thought, the upper region is heaven, the middle region is man, and the lower region is earth. Hence the name of this point, the earth pivot. Thank you for your attention.
Now we go to the gathering points. Bladder 17, the diaphragm Shu. To locate, bladder 17 is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the 7th thoracic vertebra, which is the T7. The spinous process of T7 is approximately on the level of the inferior angle of the scapula, as we observe here in the picture. Bladder 17 is located on the level of the lower border of its spinous process and 1.5 June lateral to the midline at the highest point of the paraspinal musculature. Or use the spinous process of the T3 for reference, generally on the level of the medial end of the scapular spine. Also, we can use the C7 as a reference point, located on the same level of the D9 on the midline, a point of EXB2, 0.5 June lateral to the midline, and bladder 46, 3 June lateral to the midline. Okay? With the needling, it could be 0.5 to 1 June obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during the needle retention. The needles can be secured with tape. The cushion is for the pneumothorax. For the actions and indications, the bladder 17 pulls blood heat, stops bleeding, removes blood stasis, nourishes and harmonizes blood, and yin. It also regulates the diaphragm, descends counterflow Qi, moves Qi locally and along the channel pathway. For the special features, bladder 17 is a back-Shu point of the diaphragm, the meeting point of the blood. Okay? Bladder 17 is an important point with many functions. First of all, it has a multifaceted effect on blood as it can invigorate, cool, and nourish blood and stop bleeding. Its primary function is to invigorate blood and stop bleeding. An interesting passage in the explanation of acupuncture points correlates the multiple functions of this point in relation to blood to its location in between bladder 15 and bladder 18. Bladder 17 communicates with bladder 15 and bladder 18 below. The heart generates blood and the liver stores blood, hence this point affects blood. Firstly, bladder 17 invigorates blood, that is to remove stasis of the blood from any organ, but only if needed, no moxa, with either reducing or even method. It is used as a general point to remove stasis of blood in any organ and from any part of the body, but especially of the upper part. It can be combined with the back transporting points to eliminate stasis of blood of the relevant organs. For example, combined with bladder 18, it removes stasis of the liver blood, while combined with bladder 15. It removes stasis of the heart blood. As bladder 17 invigorates blood, especially in the upper part, and spleen 10 in the lower part of the body, these 2 points are frequently combined to invigorate blood and eliminate stasis in any part of the body. For the clinical note, as bladder 17 invigorates blood, especially in the upper part, and spleen 10 in the lower part of the body, these 2 points are frequently combined to invigorate blood and eliminate stasis in any part of the body. Secondly, the bladder 17 pulls blood and stops bleeding, but primarily bleeding upwards. That is coughing of blood, vomiting of blood, and epistaxis. This action in stopping bleeding upward is also connected to its action in subduing rebellious Qi, a pathology that is often present in bleeding upwards. Thirdly, although the ancient texts seldom stress this function, bladder 17 can nourish blood if used with direct back-Shu. It is therefore used for deficiency of blood of any organ. It is usually combined with the back transporting points to nourish the blood of the relevant organs. For example, it is combined with bladder 18 to nourish liver blood, with bladder 15 to nourish heart blood, and bladder 20 to promote spleen function of producing blood. Fourthly, bladder 17 moves Qi in the diaphragm and chest and is used for feeling of oppression and pain of the chest and fullness in the epigastrium. Fifthly, bladder 17 pacifies stomach Qi and it subdues rebellious stomach Qi, which is stomach Qi going upward instead of downwards. It therefore treats such symptoms as hiccup, belching, nausea, and vomiting. Sixth, bladder 17 has a general tonification effect on all Qi and blood of the whole body. If used with direct moxibustion, to this effect, it is usually combined with bladder 19, and the combination of these 2 points is called the 4 flowers. Another combination to tonify Qi and blood in general is with bladder 18, bladder 20 with direct moxibustion. This combination is called the Magnificent Six, counting each points bilaterally. So, sa summary of function, bladder 17, it invigorates blood for heart pain, stabbing chest pain. It also cools blood, stops bleeding, like coughing of blood, vomiting of blood, and nosebleed. The bladder 17 also nourishes blood with using direct moxa, opens the chest and diaphragm, subdues rebellious Qi for epigastric pain, vomiting, hiccup, difficult digestion, sour regurgitation. It also benefits the sinews for painful obstruction syndrome, the B syndrome of the whole body, pain in the whole body, swelling, distension, and pain of the body. It also tonifies Qi and blood with bladder 19. Thank you for your attention.
Let's continue with chronic fatigue syndrome. We are now on our third and final installment of the pattern dampness in the muscles. Case history. We have a 31-year-old man who had suffered from chronic fatigue syndrome ever since he caught a viral infection 2 years previously. He had had another viral infection 2 months before he came for treatment, for which he had not recovered and experienced severe muscle fatigue and ache. His limbs felt heavy and his concentration was poor. He felt exhausted all the time and often dizzy. His stools were loose and his glands swollen. He often felt hot and thirsty and had a pain under the right rib cage. He also had a constant feeling of fullness in the epigastric area. On interrogation, it transpired that he had also had a herpes zoster infection 1 year before the viral infection that triggered off the CFS. Tongue was red and had a thick, sticky yellow coating that was clearly much thicker on the right side. Pulse slippery and wiry on the left side and weak on the right. Most of his symptoms very clearly show the presence of damp heat, which was present in 4 areas. Stomach and spleen, manifested by loose stools and epigastric fullness. Muscles, muscle fatigue and ache, weakness of limbs, tiredness, swollen glands. Gallbladder, sticky yellow coating on the right side of the tongue, hypochondrial pain, and head, the dizziness. In this case, heat was quite evident given the red color of his tongue, the thirst, and the feeling of heat. Treatment principle, he was treated with acupuncture and herbs. Principle of treatment was aimed at resolving dampness and clearing heat first. The main points used were Li11 and spleen 9 to resolve damp heat, triple burner 6 to clear heat from the gallbladder and any remaining heat, Ren 12 and stomach 40 to resolve dampness and phlegm. Other points used later in the course of treatment were stomach 36, bladder 20, and bladder 21 to tonify the stomach and spleen once the dampness was resolved, and do 20 to raise yang and lift the mood. We have another case history, 59-year-old woman who suffered from exhaustion, weakness and aching of the muscles, weight gain, and a craving for sweets. All her symptoms had started 5 months previously, soon after returning from Thailand. Her tongue was red with a sticky coating, and it was partially peeled in the center. There were also some stomach cracks. Pulse was rapid and slippery. This is another case of CFS, probably following a viral infection contracted in Thailand. Before this occurred, she was very healthy and active. Her main presenting pattern was again damp heat in the muscles. In her case, the damp heat had not affected the brain, which augurs well for the prognosis. The partially peeled center and cracks on the tongue indicate a previous stomach Qi deficiency. Principle adopted was to resolve damp heat and tonify stomach Qi. Another case history. 22-year-old man had been suffering from CFS since the age of 8. It is rather unusual for CFS to start at such an early age. When he was 8, he had a severe attack of dysentery, and he never fully recovered after that. By the time he was 10, he suffered from tiredness, dizziness, muscle ache, mouth ulcers, itchy anus, insomnia, poor memory, stomach ache, and mental fogginess. He came for a consultation when he was 21. At that time, his main symptoms were muscle ache, extreme fatigue, brain fog, dizziness, blurred vision, insomnia, irritability, poor memory and concentration, mouth ulcers, abdominal fullness and pain, thirst, dry lips. Pulse was slippery and moving, tongue was red with a rootless, whitish coating. This young man suffered from a very clear case of damp heat. The symptoms of dampness are muscle ache, brain fog, poor memory and concentration, abdominal fullness and pain, slippery pulse. The symptoms of heat are insomnia, irritability, mouth ulcers, thirst, dry lips, red tongue. The damp heat is situated in the head, stomach, and spleen, and in the muscles. The symptoms of heat are quite pronounced. The heat was situated also in the heart, as evidenced by the insomnia and irritability. His mother said that he sometimes became so frustrated that he punched his pillows furiously. One particular feature of his condition was the moving pulse. This is the Lao pulse in Chinese. That is a pulse that is slippery, short, and rapid, and that gives the impression of vibrating rather than pulsating. This pulse indicates shock, and the pulse can maintain that quality for many years after the shock. So his problem had not been caused purely by the infection suffered with the dysentery, but he must have had a shock as a child. The mother was asked whether this was the case, and she confirmed that although she did not want to discuss it further. As for the tongue, the whitish rootless coating is indicative of a candida infection, which was the cause for this young man. Although there is a school of thought that attributes the etiology of CFS to candida infection, the candida is seen as another symptom of dampness. The rootless coating indicated Qi deficiency and Yin deficiency of the stomach. Thank you very much for your attention.